to share my screen. Okay, there we go. So welcome to the second session of the PCA HCCN Professional Development Series. So today you will be hearing first from Suzanne Spear. So she's a Senior Director of Workforce Development. And then I'm going to be going in depth into our retention and recruitment plan instructions. So really the goal here is to hopefully have you guys understand, how to use that instruction booklet so then you can go ahead and pass that information on to your health centers. Why are my slides not advancing? Okay, there we go. So sorry about the technical issues. So we are here today with, oh my God, I'm so sorry for that. With the Association of Clinicians for the Underserved. I'm going to go through these slides very quickly because we talked a little bit about it in the first session. My apologies. So ACU, our focus is about access to care and clinical support. We do that through retention and recruitment. And then as you can see here, we still have like our sort of main areas are the National Health Service Corps. We have resources, training, and networking that we do. And all of you are here today through the STAR Center. So all of us are part of the STAR Center team, the ones who are here from ACU. And all of the resources that we're going to share, you can go ahead and find them on chcworkforce.org. And this is the health center staff. So as I mentioned, I'm Michelle. We have Suzanne on the call. We also have Mariah, and Sabrina was here last time. Unfortunately, she couldn't be on today, but she will be here for the next session. And then quick housekeeping items. This is being recorded, and we'll make sure to send the recording to everyone after. Please use the chat box to ask any questions, share any comments or thoughts. If you're having any difficulty, Mariah can help you, so just go ahead and contact her. And please complete the evaluation at the end. That is always extremely helpful and important for us to have. So I'm now going to go over and pass it to Suzanne.
Hey everybody, sorry, I was trying to get my my things on. Can everybody hear me?
Yep, okay, I can hear
great.
You.
Sorry, I couldn't see myself for a second. I don't know what's going on with the internet today, you guys. Like everybody's having craziness. So I wanted to start out today and talk to you guys a little bit about strategic planning and why it's important to think about when we're talking about recruitment and retention plans. So when we think about strategic planning, we're really talking about that 20,000-foot overview about what is going on with something specific at a health center. And for those of you who have been around for a while here at the STAR Center, you've seen this graphic before, but I really think it's a great representation about taking something and then making it successful, right? So you start with an idea, and then you have to go and you have to plan, plan around it, depending on what it is, come up with a strategy, and then you're gonna have success. So when you guys are talking to health centers, it is really easy for them just to say, okay, well, what do I need to do? Like, let's just do the thing, right? The point that you guys are making through all of your training in TA is that it's a process, and whether or not it's about quality improvement or patient outcomes or patient satisfaction, you have to have a system in place in order to address it. So strategic planning is just that. So you're really going to have, you want to have a plan in place and be able to address these items that are going to come up in workforce, and you do that by strategic planning. Next slide, please. So what is strategic planning? Well, strategic planning, according to the Nonprofit Support Center, is a disciplined effort to produce fundamental decisions and actions, that's a big one, actions that shape and guide what an organization is, what it does, why it does it, with a focus on the future, right? So those what and why are really big here. And so I don't know about you guys, but strategic planning is kind of this big, scary words that come into play. And, but it shouldn't be. And so when you're talking to your health centers about workforce planning and about doing their workforce plan that you guys need to have them do as a part of your cooperative agreement through the Bureau of Primary Health Care, strategic planning is also important as well. So even though it's not a directive, we just wanted to show you the resources that we had and why we're asking folks to do it as a part of the workforce planning process, because I know that a lot of your health centers are already doing strategic planning. It's something that they do with their boards and their C-suites, but workforce strategic planning is important as well. So when you're doing workforce strategic planning, when your health centers are doing workforce strategic planning, you want it to be a couple things, right? You want it to be responsive. So what is the community going to need and when are they going to need it? You want it to be, you want them to have it be reality oriented, right? So you want them to have a realistic view and goal about what's going on in their health center and outside of their health center in order to make these things happen. And then you want them to be ready as a result of these strategic planning actions. And so what do they need to do to avoid crisis-driven actions? And this was put together before, this workforce was put together before COVID happened. And probably no one on this call could have anticipated the global pandemic. I know there are lots of discussions about we should have anticipated, okay, it is what it is, right? It's not like a hurricane or a fire or anything else like that. But largely, strategic planning is going to help prepare health centers for most things. And from a workforce perspective, right? Because that's what we're talking about, workforce here. So anyway, it enables them to have these plans in place. So if something happens, and they can respond to it and be really agile and able to make decisions very quickly. Oh, I'm sorry, I don't have the controls. Would you forward it, please, Michelle? So sorry. Okay, here we go. So with strategic planning, really you want to focus on two things. And when your health centers are doing this, they're going to be looking at two things, right? So they're going to be looking at the internal factors and the external factors. And so the internal factors are things like your mission, vision, and goals of your organization. This is huge. This is something that's just focused into everything that a health center does. Patient experience. What do your patients think about what's happening at the health center? What's their patient satisfaction? Present scope. What types of care do you have at your health center, right? So what kinds of care do you offer? And then some other things, workforce. Would you go back a slide, Michelle, please? Thank you so much. And then talking about external factors, right? No, my gosh, it's totally fine.
My computer got a brain of its own.
No problem at all. And then we have the external factors, right? So these are trends that are happening in your area, right? So population trends, policy payment trends, that's really big now. We're talking about 340B and how that affects everything. And even those things can affect workforce. And then also workforce trends too. So you have your internal workforce, like who you're hiring and who you have on staff. And then you have your workforce trends about different things that are happening outside your four walls as far as all the trends in workforce. So next slide, please. So when we take those internal and external factors, we want to do a couple things as we are going through the strategic planning process. So you want to define the factor, whatever it is that you're looking at. You're going to collect and analyze that data. You're going to discuss the options and then make a plan. So it's really those four things. And so if you're talking to health centers about this process, you can say, this is you got this, right? You can do this. You can take each factor and you can go through these four different steps and ultimately end up with a strategic plan. Next slide, please. Okay, so when we talk about internal assessment, next slide, please. And we think about these four different factors, you want to make it clear to them that they need to understand where they are going, because if they don't, then they won't know how to get where they need to be, right? So if you don't know where you're going, any road is going to get you there. So you need to know where you're starting. And Michelle's going to talk about that too when it comes to the recruitment and retention plans and doing that assessment. And it's super, super important. So when you're talking to health centers, and I know they have so much on their plate, but analyzing where they are is going to inform where they're going to go. And it's really going to make a huge difference in how they look at things, figure out what needs to happen, and then develop a model for their future. Next slide, please. And then, so if you have an understanding, an idea of what's going on internally, and then making a plan internally, then you can also look at the external factors. Next slide, please. And all of those trends that we just looked at really quickly. And so you're gonna figure out, figure out what's going on outside your four walls. You're gonna analyze that and figure out what your workforce needs to look like in order to address those trends, and then discuss those next steps. Next slide, please. And then finally, you want to, first of all, I love this, take a deep breath and reflect. And that's like with all of the workforce planning, right? When it comes to strategic planning, when it comes to workforce planning, like in recruitment and retention plans, all of that, like you just want to like take a deep breath, right? We can do this, and they can do this. You guys can train them, and they can actually do the thing, because as much as we want to help them do the thing, we can't do it. So we might be able to hold their hand through it, but we need to enable them to do these things, and they can do it. So when you summarize all those things, you figure out what you found out from both the external and internal assessments. You're going to analyze what you've learned and figure out if you need more information to develop a plan going forward. Next slide, please. And then what these next two slides are actually showing the strategic workforce matrix and action plan. Next slide, please. And so these are a valuable resource. And Michelle's going to spend a lot of time talking to you guys today about our recruitment and retention plan. And it's chock full of these tables. They are in a Word template. They are completely customizable. So health centers, you can send this to your health centers and say, hey, look, do the thing. Like, we're not just asking you to do it. Here, we're giving you an opportunity, and everything's already been laid out for you, and you can fill these things out, and then you can check the box, and you can really not only just check the box, but have a deeper understanding about what's going on at your health center and how you're going to get there. That's the big idea here. Okay, and one thing I want to point out before Michelle forwards the slide is that strategic planning and the strategic plan itself is a dynamic tool. Something else that the recruitment and retention template that Michelle's going to go over today is a dynamic tool. And so we want to emphasize with our health centers, and as you guys are doing training, emphasize that this is not a one-time thing. As much as we would like to just do the thing, check the box, and put it on the shelf, that's not really going to help. So in the end, we want to make sure that this is a process that if we do it now in 2020, or most likely in 2021, it's not just going to be something that you're just going to put on the shelf. You're going to revisit it every once in a while, or as needed. If something really big happens at your health center and you need to, redo some things, that's okay. But at least you'll have a foundation. Next slide. Thank you so much, Michelle. So I know I went over that really quickly, but really it's just sort of a primer to show you guys that we have all these tools and resources when it comes to strategic planning and workforce planning. Mariah has put our strategic planning workbook and the accompanying resources there. We have a fantastic webinar recorded from Pamela Byrne. She works with JSI. We work with them. We're partners in this, and it really is great. It is something that you can send to your health centers and just say, hey, this is exactly how you need to do it. It demystifies it. It takes it from this really big, scary thing into the small bite-sized pieces. And so, and again, those accompanying resources that are talked about in the document are here as well. I hope that you guys will check them out if you haven't. Okay, so Isa asked who in the community health center should be developing and leading this work? Well, that's a great question, Isa. I think the easiest way to say this is probably going to be different at every health center. So the strategic planning process is probably going to need to be driven by your C-suite. They are going to be the ones that are going to know, probably have the best access to a lot of this information, but they're probably going to need to bring in the HR team, maybe your CMO, your practice managers, things like that, because as I mentioned, we have those patient experience, all of those different factors that come into it. So while your C-suite is going to drive the strategic planning process, you're probably going to need to bring other people in. So I would say probably your C-suite. They're going to be one that's doing the strategic planning part, and then what Michelle is going to be talking about today is probably going to be driven more by the recruitment HR staff, but they're going to be needing to involve the C-suite. So it's kind of that inverse. And they really complement each other, as seen here in those resources. So feel free to ask any other questions you can. I know that Michelle has some awesome content that she's going to go over today and really talk you guys through all of the recruitment and retention workbook and how you guys can help utilize this to assist your health centers in that process. Thanks, you guys.
Thank you so much, Suzanne. That was excellent. And yes, I am going to be going through our recruitment and retention instructions for the recruitment and retention plan. Now, just to kind of give, there's a lot of slides that are on here, so I kind of want to explain the thought process as I put this together. So we really wanted this to be a train-the-trainer. So I'm going to go through certain sections, and then I'm going to go and I'm going to share the actual retention and recruitment plan instructions, so you guys can see on there the different charts that we have, the examples, and the goal is that you can really use those instructions as kind of like the manual that you will be putting together in order to talk to the health centers about this. Also, the slides are a little bit text heavy. This was done on purpose because I also would like you guys to be able to have this PowerPoint as a way to sort of use it in your own presentation. So for each of the sections in the instructions, I pulled out certain parts of it, but we'll go through it quickly so it doesn't seem so overwhelming, because there are a lot of parts to it. But before we get started, I believe Mariah shared the link. Yes. So that is the link to the R&R plan. If any of you want to follow along and download the instructions, please feel free, but I will also be sharing that screen, so you definitely don't have to. So I just want to start with, when we talk to the health centers, when you guys talk to your health centers, why is workforce so important? And I think at baseline, it's really emphasizing that the workforce is the fuel. This is essential to everything that you do in the organization. So being able to make that case for why there needs to be an investment for it is key. And then here at the STAR Center, we talk about these different components that really make up a high functioning health center. So you can also take from this and use these different materials to kind of make your case to them as to why workforce is so important. We've heard in the field in some other trainings that we've done where it's like, we understand the importance of this, we know why it's important, but we don't really have the resources, we need the buy-in, we're in the middle of COVID. So always try to look at it from that lens of, there's so many different parts to it, and that really encompasses everything that your health center does. And in order to provide the services of the health center, you have to have a workforce. And the other thing that we tend to emphasize to the health centers is that HRSA is really focusing on this as well. So there might be that other push and incentives. So they're talking about the Advancing Health Center Excellence. So you can see these different strategic areas that they're looking at. So this is just sort of like that overview of why is this important, and now I can go ahead and get into the work plan. I see there's something in the chat. I just want to make sure. Oh, sorry. Yes. Yes, I agree, Isis. He had sent me a message. And yes, text-heavy slides, definitely not best practices. So I tend not to do that. But this was really so that you guys could use it and kind of make something, whatever you need from it. So when you're creating a workforce plan, what is the goal? It really is about tracking successes, identifying failures, innovating with data. Data is key, and ensuring alignment with those goals. So as your health centers sort of go into doing this recruitment and retention plan, really keeping that in mind. And that's why Suzanne went over the strategic workforce plan, because once once the health center has that in place, it makes it much easier to then take those different components and put it into all of these, the assessment that you need to do, how do you work on retention, how do you work on recruitment, and making sure that you're collecting everything you learn. Right now things are so chaotic with COVID for so many health centers. I would probably say every health center. But there are a lot of lessons learned that they're getting, a lot of data that they may not even realize they're getting it, because it's sort of in this immediate sort of crisis situation. But in the future, they can really see what works, what doesn't, and how can we move forward with that. And, how do we keep the providers that we have, and then how do we bring in those mission-driven people? So here is where we go into the provider retention and recruitment plan instructions. And the purpose of this, the plan itself, is really just to help health centers be able to develop a written, and we call it a retention and recruitment because we really look at retention being the first, you want to keep the right people in the health center. And then with that, you really know who you want to bring in. So we kind of flip it around because a lot of times we talk about recruitment before retention. And there's 3 different documents that we have in the STAR Center, and that's the link that Mariah provided. I will be going over the instructions, but the template is for the health centers to use. The instructions is hopefully what all of you could use to really help inform your health centers as to how to use the template. And then the action plan just includes a lot of those charts that we were talking about. And then here it just describes, the instructions is how to use the retention and recruitment plan. The template can be modified. They're all in Word documents, so they're easy to track, and it's specific to the health center, and not just specific to the health center, but also specific to the specialty. So in the future, we're going to be doing a learning collaborative on recruiting mental health providers. So that's another thing that you can modify all this to really meet the needs of not just the health center, but the type of providers and clinicians that you're bringing into your health center. And as I said, the action plan is really that place where you can track everything. It has all the charts that we will be going through. Okay, so the reason that we have this, why we have this plan, is it needs to be written down and it needs to be reviewed. So your health centers probably have a lot of information when it comes to, what are the best ways to retain someone, what are the best ways to recruit it. But if it's not written down in a formal way, it's very easy to kind of get lost in everything. And then also, you don't need to recreate the wheel. Once you have a formal plan, you can always refer back to that. You can change it every year. So I'm sure there's plenty of changes that need to take place this year with COVID, but it's something that you have that, initially may be more time intensive, but once you have it, really helps kind of create that flow that you want. And I'm sorry, I'm trying to check the chat. Oh yeah, Mandy, we're currently deciding on all that. So I will let you know once we'll have it out in our newsletter, but that'll be in the spring when we're doing the mental health provider recruitment. Okay. So in our R&R plan, we have 3 main sections. We have the assessment, the retention plan, and the recruitment plan. And as I mentioned, I'm going to go through these kind of quickly in the slides. I'm going to transfer over to the Word document and then come back, and I hope this works. Anybody can stop me at any time, ask me any questions. And I'm sorry if it takes me like a moment to get to the chat because I'm trying to share and watch the chat at the same time. So in our R&R plan, in the instructions, it talks about, before really starting anything, you need to do an operational assessment and you need to have strategic planning. And it breaks it up into these 7 categories that are key components to understanding really how the health center is functioning and what would make a provider feel that they want to stay, and then also bring a provider into your health center. So we'll go through each of these areas, but, oh, great. Thanks, Mandy. So as you guys see, I'm going back and forth between the chat and this. And this is something that it's great to break it down into these key areas, because you don't want to mix everything into one thing. You really want to understand all of the key components that may affect your recruitment. Also, sometimes when you think we need to recruit somebody new, the issue is not really recruitment, is something else going on in the operational part of it that could be changed, that then would allow, you know, just sort of that better cohesiveness throughout the health center. And as I mentioned, why is it important? Because without that comprehensive assessment, it's really difficult to determine your true recruitment needs. And that assessment also helps you understand where you are in regards to retention. So this is something that you would bring to your health center. If they asked, you know, why is this important? You can really determine that and have it explained to them that first it's focused on how do you keep people there, but then it lets you know what do you actually need for recruitment, so you don't spend the time and money recruiting someone and then not have it work out. So our R&R plan, the first part that it talks about when you're doing the assessment is to talk about provider capacity and demand. So you want to assess your provider productivity, and in a second I will go into the R&R plan as I mentioned, and we have documents that help you break it down, and you could use that if anybody in your health center comes to you and asks you, how do I fill out this chart? It has directions exactly how it is. And then once you're able to assess the provider productivity, you want to be able to analyze any difference. So you're looking at it against UDS data, and you want to see, is the provider productivity of this health center falling within 10% of the average of health centers around the country? And if there are substantial differences, then why is that? And that's what this chart tells you. This is also in the R&R plan. So we lay it out as low productivity, what are the possible causes? And as you can see here, there's many different things, and then the possible consequences from that. High productivity, we think, oh, that's great, but it could also very quickly lead to things such as burnout, staff stress. So then you're losing someone who does great work simply because there's too much. So you can decide, okay, is this a situation where we really need to recruit someone? Or is it that we need to change, you know, the way that we do our staffing? We need more non-provider clinical help, whatever it may be, in order to really have it be a good balance in your health center. As part of this assessment, you also want to let your health centers know that they should look at appointment availability. So that also plays a role in understanding the whole function of the health center. So the way that we have it in the R&R plan is called the third next available appointment method. So every health center should have a policy of how long it should take for someone to get an appointment. So if it's a regular checkup, if it's, you know, like a first time patient that's coming in, and the way to really accurately assess that is see which one is the third available appointment. And the reason for that is sometimes you may have a cancellation, so then you can fit a patient in there. That's not really accurate to meet whether or not your providers are meeting the policy that's set up with the health center of how long a patient should wait. So both seeing what is the provider's capacity, and then also seeing, you know, how accessible it is for the patients to be able to come in is a really good way of understanding, you know, is this a provider who works at a very high pace? Is this someone who's stressed out? Do we need to just change some things? Do we need to recruit someone in or not? And this is another chart that when you take it all into consideration, we lay it out to really understand, as it sees here, do you need to recruit? When do you need to recruit? So planning for the future. And what are the situations and the different actions that can take place? So that's what this plan is great and the instructions are great because you can build out these scenarios for your health centers as you're speaking to them about this, but also sort of bring it in for yourself to better understand, you know, before we go and say we need one thing, let's look at the whole picture. Okay, and I just wanted to make sure there was nothing in the chat. So I'm gonna see if this will work. I was trying to see if we could go back and forth easily between this and the Word document before we move on to that. So this is our instruction plan. As you can see, there is a lot on here, but really the key is going to these different areas, and here are the different charts that your health centers will be able to use to fill them out. So as I talked about the provider productivity, this is one of the charts, and it can be customized for exactly what they need. Here are the instructions, exactly how to complete the table. So this is the one where you're looking at the full-time equivalent, and how productive are they based across UDS means and other health centers. So you want to be able to put together those measurements, use this table, and then this is the next table where you can go in, use the analysis and see if it's greater than 10%, why is that happening? And what's helpful with this is again something that you would keep in writing and you could always refer back to. And all of these pieces, they work together, they play with each other. It's not kind of its own individual group, but you need to take it piece by piece. And that's something as well that we would want to emphasize to your health centers. Those same charts that are on the slides are here. I moved them to the slides, so if you ever need them, you can have them on there as well. The appointment access, as I talked about, so it always has a description of what that section is. And then there is a chart, and usually it has an example of how to fill out the chart, or at least instructions. So you can pull this and submit it and give it to your health centers if they need it, or the health center itself could just go to the STAR Center and have this information. And then every time there's going to be this sort of analysis chart, because you're collecting this information, but what you really want to do is help understand why are we having these issues, or also why are we doing great? Because if you're doing great, you want to be able to keep that up. So as you go through it, you're going to see different tables, different charts, and then different kind of examples as to what that may mean and whether you need to recruit or if you need to look at changing certain things in regards to retaining someone. So now I'm going to go back to the PowerPoint. I think it's working, but if it doesn't, I may just stay in one document versus the other. Okay, so as you go through the assessment, there's still a lot of other things that your health center needs to look at and things that you need to really talk to them about and explain why they are important. So one of them are the care teams and provider mix and the non-provider staff. So the providers never by themselves. This is all about a care team. And you want to make sure that they have the support that they need. But also, as it says here, when you're doing these different assessments, you can kind of see, well, does it really make sense to bring in, you know, a physician provider, or can we bring in a non-physician provider? So all of that other information that you've accumulated can help you in being able to make those assessments and then really deciding what is the best provider mix for my health center. And that's different across the board. It's not going to be the same for every health center. When you look at this, also taking into account diversity issues, equity issues of who you're bringing in, who is your community that you're serving, who is needed there. You know, there's so many complex kind of aspects to it. So that's why using like those simple charts, it's really helpful, because in those areas where you can just write in the why and put in comments, you can start looking at all these key areas that you then want to use as you put together retention benefits and all the different things that you need, and then also your recruitment plan. And just to keep in mind, I'm sure most of you know, the non-physician providers include nurse practitioners, physician assistants, nurse midwives, not registered nurses or medical assistants. However, they are just as important. You know, it's important for everybody to be able to work at the top of their license and be able to work as a team, and the support staff is there exactly for that, especially now as we look at components of burnout. Being able to have a well-trained support staff can be incredibly important and valuable to really have somebody feel that they want to stay in the health center. And then the support staff also should not be there only to solely you know, help the provider in issues like burnout or whatever it may be, but the health center also needs to support their own support staff. So we really need to think, when you're having the leadership buy-in in looking at retention and recruitment, that everybody in the health center is really being treated in that equal manner, and that they're getting the help that they need to be able to do the work that they want and provide the quality of care for the patients. And then those last few categories, one of them is looking at patient schedules. So this is a big part of better understanding, are we overworking our providers? Are the providers underworked? Do we need more support staff? Are the times that the office is open really effective? You know, is this when our patients can come in? What are the high times in any sort of office setting of when we're seeing more patients, so then the providers kind of get swamped a little bit more? How long are those clinical sessions when they're seeing a patient? Do we have the availability that we need, all the way from the support staff to enough exam rooms? Do we have the right provider specialties? You know, what type of patients are we seeing? And I really want to highlight that as well, because you need to understand who is coming into your health center and understand who is in the community. And if you can have that right connection between your patient demographic to really also have your providers be able to mirror that, you could have much better quality of care, but also happy providers in and of itself, a sort of a stronger cohesiveness. And then just different, you know, preferences that your providers may have of working on a Wednesday rather than a Friday, on-call hours, all those different types of things. And we do have a chart that I will show you in a moment in our R&R plan. And again, this is something you can then provide to your health centers to have them fill it out, and that they can think of all these different components, because it's very easy to kind of just overlook one thing when that one thing can really be what's causing some of these issues. Oh, did someone want to say something? Oh, I thought I heard someone go off mute. The on-call schedule, as I mentioned, really look at it, make sure that you're not overworking your providers, that you really have things in place that are appropriate. Small rural health centers, that can definitely be a major issue when it comes to retention and recruitment. So we have laid out here different strategies that your health centers can use, and they can kind of hopefully have the best of what works for them, so that then it works for their providers, it works for their patients. I mentioned, look at those high volume times and see the flexibility that you can offer during that, and what changes you can make if they need to be made to the health center, or you know, what changes you can talk to your health center about if needed. And then all of this kind of wraps up into looking at provider satisfaction. Staffing, workload management, financial considerations, scheduling and vacation all play a role in this. So your health center has taken all of these different components, filled out all these charts, put all these things together, kind of put it away, something they can review annually, because these things consistently change depending on what's going on. We see it in COVID, workload, staffing, management, all of these things are very different now because of COVID. So it's also validating where your health center is at and validating for them, you know, that we understand the complexities of this, but if you're able to have something that you can easily modify, it doesn't feel as overwhelming. And we want to make sure that not just providers, but everybody in the health center really has that satisfaction. Like I said, especially now with the rates of burnout across the board with everyone, you want everyone to be taken care of as best as possible. And before I go to this, let me go back to I don't know how well it's working with the going back and forth, but I may just say, you guys can kind of look through this. But one thing that I will point out though, is you'll notice, again, we have some of these charts pre-filled out. So you'll find that all in the recruitment and in the retention and recruitment plan, but in the instructions, it's going to give you examples. And it's going to have UDS data that's already in there. And yes, this is from 2014, but very easy. The health center can know, okay, this is what I need to pull. This is how I do it. So these are the ratios of non-physician providers to physicians, the support staff, patient schedules. So here's a chart that a health center can create, or a graph to look at when are their times of high volume, breaking down every key part. So, you know, who are the providers that are working these days? What are the support staff that they have? What are the rooms that are available in the morning, in the evening? So we've really broken this down into very concrete, specific areas. The on-call schedule as well. You know, we have this throughout where any health center can use as part of their template. As I mentioned, the provider satisfaction and these provider surveys. So we have these quick examples, and then it takes you back to the STAR Center so you can get more information on that. And I think next time I may just stay in the PowerPoint. In my mind, it was a little bit more seamless. Okay. So it's also important to talk to your health centers that when you're doing an assessment of where everything stands, you need to talk to the people in your health center. So there's a lot of talk about exit interviews, but when someone is doing an exit interview, it's because they're already leaving. So you also want to focus and sort of educate and inform health centers about the importance of stay interviews. You know, we want to know why people are staying in the health center, and then you use that information as other retention tools and ways to get people to come into the health center. So the more information, the more data you can get as part of your assessment and just in general, the better it is. So talk to people, find out why they stay, find out why they leave. You need to understand the good, the bad, the ugly, so that you can really make the changes that are necessary. Succession planning also incredibly important. You know, unfortunately, this is not something that's always focused on, but it needs to be, because people will retire. Some people won't retire, but you know, nobody lives forever. So at some point, somebody is going to have to replace somebody else, and you want to be prepared for that. Again, in our instruction, there literally is a chart that you can lay out. You know, if someone has told me they're going to retire in about 5 years, what is the plan that I'm going to do? Someone's reaching the age of 65. Do we need to then recruit a new provider? Do we have enough staff to sort of fill that already? Could we bring someone into that role, especially with leadership? The more that you're training kind of within your health center and making sure that people are able to move up and take the roles when needed, that's excellent. And especially now with COVID, we've heard of a health center who I believe both the CEO and the COO quit around the same time because of the stress with everything. So, you know, you don't want to find yourself in the middle of an even bigger crisis, but rather, you know, prepare for it and make sure your health centers understand the importance of it. And now we move into the retention section. So that's, we did the assessment, and now the health centers can look at why retention is important. And as it says here, the best strategy to minimize recruitment problems is to retain the providers in the long term. So, you know, when you're talking about why retention matters, really emphasize that point. And when looking at retention, there's key areas. You really, as a health center, need to understand your mission. Make sure you have a mission, a written mission that you are consistently looking at and changing. Make sure that your providers are in line with that mission, that what you do, the services that you give your patients, but also your workforce fit into that mission. Equitable compensation, benefits that really allow your health center to be competitive. So really talking to them about ways that they can stay competitive, even in a market where they may not have the number of resources as sort of the hospital system or something like that. Flexibility in work schedules and career paths, those are big things that can bring someone into a health center. And this is my favorite slide, the little Mission Impossible guy. So sorry, I just had to point that out because I really loved it. And as I mentioned, your mission or your health center's missions, and every health center will have their own mission, but it needs to line up with the beliefs and values of the people who are working there. And the leadership need to model that with their workforce in the same way that providers model that with the patients that they take care of. And when you have that cohesiveness, you will have people who will want to stay at the health center. So the R&R plan has, again, a little section where it's just like sort of you fill in what's your mission, where's the mission posted, and when was the last time that it was reviewed. The other key points of retention, again, making sure you have equitable compensation. So you want to be competitive in your local market, but there also is the understanding that you may not be able to offer exactly, like I said, a big hospital system may be able to offer, but when you connect it back to the mission, when you connect it back to, working in your community, working with populations, what you're trying to achieve and do, make sure that all of this plays a role in it. The benefits as well. You want to look at creative and innovative ways to kind of look at the different benefits. So one of them, for example, is offering educational benefits. So continuing education, support for licensing. One of the things we were talking about with, for example, with social workers in your health center, offering supervision hours prior to their licensing. So bringing in somebody who has a master's, may not have a license yet, but you're able to offer as part of the benefit that they're being supervised, can really be attractive to someone. Flexible work schedules. I think more than anything, we've learned this with the time of COVID, and understanding that, especially some of the newer, younger providers, they want that flexibility. You may have somebody that's great and may not work full time, and that's okay. So, make sure you have enough coverage, but you can get somebody wonderful that'll work part-time, and then you can bring in the people that you really need. And career paths. People want to be able to grow and advance. And again, all of this, we have all the charts where you write all this out as the health center, exactly what you need and how often you need to review it and how to go ahead and do that. So I'm going to try to go a little bit quickly because we do have a lot of slides, but the third part of the instructions is our recruitment planning process. So once you've assessed everything and you say, okay, we really do need to bring someone in, there's sort of this scale that you want to look at, all of these key areas. And I will go to a template in a second, but let me try to go through this quickly. You want to identify or let your health centers know that when they're recruiting, you want to look around and see what the community is also doing. So what are other hospitals planning? What are, other provider offices? And get them involved, maybe partner with them. Really be innovative in the way that you do those recruitments. Identify ways to collaborate. Have a recruitment team. So I believe one of the questions earlier was, who would really be involved? This is where you start getting a bunch of different people involved. May not be part of the administrative part of the recruitment, but they're just as important to bringing in a provider. So you want to set priorities. Your health center needs to look at the big picture, needs to understand, all of that strategic planning that you did now comes into play with your recruitment priorities. Develop a budget. Recruitment costs money, so making sure your health centers also understand that. And this is in the template, and the reason we have so many different things is to really understand you have to take into account more than simply, you know, what is the posting for the new job, you know, what will that cost, and then the visit. Like, really look at everything, including the staff costs, the time that they're doing this. So again, this is why also retention is so important, because recruitment is also very expensive. And some people use recruitment firms, so always make sure to have all the contact information you need. Again, this chart is in the instructions. And this is something that the health center should have if they're using a recruitment firm as part of their plan, because they're able to know, did this firm work, did it not? So nobody's sort of repeating something and making the same, I don't want to say mistakes, but the same sort of issues of using someone who's really not helpful. All of that is there for anybody to be able, as you know, if somebody else is taking over in the HR role or whatever it may be, that they can access it and see the history of all of these things. You want to develop an advertising strategy. So again, looking at the cost around this, try to be innovative, leverage those partnerships. In the instructions, there's a very detailed way of writing out the advertisement, and keep a copy of all of them, because again, that's that historical planning that you want to be able to go back and look at. So here is, as I mentioned, the chart that has really how to write an advertisement. And we really just wanted to make it as easy as possible for your health centers to be able to say, okay, I need these key points. I can write it out, make like a skeleton, put it in my plan, and then put in what you need for it. And as I mentioned, recruiting mental health providers, you would want to put certain things. Recruiting an internal medicine provider would be different, you know, whatever it may be. So really, you know, just go through it step by step and keep track of it. Most health centers should be or are using social media. So it's important to talk to them about this in the same way that you are ranking what works and what doesn't work for you. If you're using a firm, if you're doing advertisement, you should also see which social media works and what social media doesn't. You just don't want to waste your time in something that isn't working for you, but make sure to start small, spread it out, and then kind of be able to assess and go back and make the changes as needed. So as part of our instructions, we also have laid out how your health center can do a candidate screening, the interview process, every single thing is detailed on there. And I think it may be helpful to go back to show you guys this, and then I'm almost done. I know it's a lot, and that's why I really wanted to spend that time literally going through each section, because if you're going to be training your health centers on this, it's helpful to break it down, not have it all be in one, but also it gives you the information you need so that you can talk to them about it. So here's the ad template that I was talking about. Here are strategies to use for social media, especially, you know, people who may not be as savvy with technology. Another chart to use, keep everything written down, always go back to it. The screening process, we even included the specific questions that you can ask. So when you're doing the phone interview, these are the key questions you want to ask. And then as you go and you take the next steps, literally everything is laid out for you. This is the first thing, go talk to your recruitment team, review the candidate's resume, and so on and so forth. And we're hoping this really makes it easier for people to understand what are the steps that they need to take to get to bringing in someone that is right for their health center. We also break it down for the visit, and here is every single logistic point that you need to think about. When you have a candidate, you're like, this candidate is right, we need to have them now visit the health center to do the final interview. I mean, everything from picking up the airport, providing itinerary. You want to think about their partners, their children, everything. So we have laid it out in very kind of clear, like minuscule detail. This is a follow-up plan for, you know, sometimes when follow up, if we don't follow up quick enough, the candidate can say, okay, well, then maybe they're not interested. So we also lay out here really how many attempts are kind of the average of what you should have. What is the timeline? Who should be doing that? Again, make it as easy as possible. The follow-up plan that you have. So what is the first interview, the second phone interview, the visit? Take everything, use it together all the way till you get to the contract and negotiation. So these are the different terms and things that should be included in your contract, as well as what you should be discussing with the candidate. So you can pull from all this and, you know, sort of put together either your own presentations or your own way to train your health centers for what really worked for them. But we wanted to lay out the key components. And then this goes all the way into onboarding. And one thing that I do want to point out, because I'm just looking at the time with onboarding, it's not the same thing as orientation. Onboarding encompasses so much more. So you want to really hit on these key activities. You want to have ways that you can be successful in it. Everything from having a mentor to, you know, assigning the right people to onboard your provider. So everything is on here. And then let me just wrap up. Let me go back. As I said, it was a lot. So, and this is, we just really want more so you guys have it, so you can use it as you need it. And then let me go through. I went through all this, the next steps, the visit, the candidate follow-up, what you need in the contract, all the onboarding. And as your health center sort of looks of, you know, what is a benefit of working in a health center, talk to them about the importance of becoming a patient-centered medical home, how to utilize the National Health Service Corps. If the state has loan repayment programs, they can use that. And then also this is a great way to do health professions training. So really making those connections with the local schools, setting up residency programs. And again, it's something, you know, that the health center will need to assess for themselves, but may not always think about. So you can really point that out to them. And then I know I went through that really quick, but, oh yeah, thank you, Mariah. Does anybody have any questions on sort of how you can really use this to then help your health centers create this? And if you do, I believe you can either unmute yourself or you can put it in the chat. Oh, thank you, Amma. Okay. And
just a quick question. Thanks for walking us through the tool and the instructions. When it comes to filling out the R&R plan, is the idea to have the health center fill out each, like, for example, looking at like the patient ratio, or not the patient ratio, but like the productivity numbers,
right,
for each provider in a health center? Or is it sufficient to have the health center just share like the class of provider and the average, or the type of, the number of patients that they're trying to see? Because
right. So that's definitely going to be health center specific. So smaller health centers, they could probably do each provider individually. Bigger health centers, definitely, that's why some of them had like provider 1, provider 2, but then they also had, you know, just internal medicine, family medicine. You need to, you know, don't totally overwhelm yourself with this. You just need to understand, you know, what area of your health center is functioning well, what area is not. So if you have a smaller one and it makes sense to do it provider by provider, do that. Bigger health centers definitely would not recommend that. So the chart in the R&R plan was specifically created to be modified and to fit both type of health centers. And some big health centers may want to do it for every single provider, and, you know, they're definitely more than welcome to do that. And I know I saw Robin saying, you know, totally overwhelmed, completely get it. I know how much information this was, but if there's one takeaway, is that our instructions are hopefully there to let you take it piece by piece. We're just trying to show you the whole thing. This is not to be done in one sitting. This is to be done over time. And Isa, as you kind of, were asking with your question, it then needs to be health center specific. They're going to understand their providers the best, their different teams. So they need to be able to, when you do that strategic planning beforehand, helps you kind of come into this and say, okay, we do need to look at certain specific providers, or we do need to look at the internal family medicine team, whatever it may be. But did that answer your question?
Yeah, no, I guess I just wanted to be cognizant of there's some organizations that have over 100 providers.
Exactly.
So the request, and especially with RTAC coming in, want to be mindful of all the requests that we're channeling.
Yes.
Okay.
Yes. Exactly. And, right now they are also tasked with doing a comprehensive workforce plan. So what our hope is that, if they can use all of these different charts and really use it as their comprehensive workforce plan, they don't have to reinvent the wheel from the beginning. So they can already say, okay, here, I have everything detailed out. I just need to fill it in. For other health centers, they may be like, I really need to modify this. And that's why we have everything in a Word document. So they can, they can do what they need with it. And then for you guys, you can really use those instructions to train them on it. And obviously us as well. Anybody can come to us, ask any questions. We're here to help. And I know we went a little bit over time, so I really appreciate everyone being here. Mariah put the evaluation in the chat box. So thank you for staying with me for a few minutes extra. And yes, totally normal to feel overwhelmed, but please contact us if you need anything. I can break down any more of these sections sort of one-on-one. I'm happy to do that. And also, I hope everyone has a great day. Thank you, everyone.